Imagine you're facing a critical medical decision, and an algorithm holds the power to approve or deny your care. This eye-opening shift is about to hit Medicare, borrowing tactics long used by private insurers. Starting January 1 in Arizona, Ohio, Oklahoma, New Jersey, Texas, and Washington, a new pilot will test how much money an AI tool could save by rejecting what it calls low-value services for seniors and certain adults with disabilities. And this is the part most people miss. But here's where it gets controversial. Traditional Medicare has largely avoided prior authorization, the process that forces patients or their doctors to get insurance sign-off before proceeding with tests, prescriptions, or procedures. Private carriers, especially those offering Medicare Advantage plans, rely heavily on it, arguing it curbs waste, fraud, and potential patient harm. Critics counter that it delays life-saving treatments, leaves patients in limbo, and masks arbitrary decisions behind bureaucratic red tape. Dr. Mehmet Oz, head of the Centers for Medicare Medicaid Services, called prior authorization a trust-eroding problem that significantly delays care. Yet days after private insurers pledged to streamline their approval processes, CMS unveiled WISeR, which stands for Wasteful and Inappropriate Service Reduction, a program that uses AI to pre-screen certain outpatient interventions like skin grafts, nerve stimulators, and knee arthroscopies. Only those flagged by the algorithm would then need human review. Opponents pounced on what they see as mixed messages. They borrow cost-cutting tools from private plans, then scold the same industry for using them, says Dr. Vinay Rathi of Ohio State University. Rep. Susan Del Bene, a Washington Democrat, accuses the administration of talking out of both sides of their mouth, questioning how a system promising patient protection spawns so much concern. Physicians across party lines warn that delay or deny tactics risk real harm. North Carolina Representative and urologist Greg Murphy puts it bluntly: insurers take our money, then erect barriers to care. Public fury flared last year when United Healthcare's CEO was shot, sparking debate about frustration with coverage denials. A July poll by KFF found nearly 3/4 of Americans consider prior authorization a major problem. Here's another twist. Medicare insists no AI recommendation will be final. Every flagged case must see a qualified human clinician, and contractors can't earn bonuses tied to denial rates. Still, experts worry that shared savings, deals where vendors benefit financially if spending dibs, could nudge companies toward more rejections. And what does human review really mean? Georgetown's Amy Killalea highlights a study showing some insurers' medical staff spend barely over a second per request. While Cigna denies using AI for prior authorizations, class action lawsuits claim certain algorithms override doctors and ignore individual patient needs. An American Medical Association survey found 61% of physicians believe AI will ramp up denials and worsen patient harm. Harvard's Kabul Shakar calls insurer algorithms a regulatory blind spot that needs tighter oversight. Indiana University's Jennifer Oliva warns companies may lean on AI to deny costly care for patients with limited life expectancy, betting they won't survive the appeals process. The longer someone's stuck in limbo, the less likely an insurer is to pay. AI has the potential to speed up approvals and cut red tape, and carriers insist it removes human bias while preserving expert judgment. But will WISeR strike the right balance between fiscal responsibility and patient well-being, or simply export the worst traits of private insurance into a public program? Lawmakers from both parties are demanding answers. Some have backed efforts to block funding for the pilot in the 2026 health budget, while others remain cautiously optimistic that physicians will retain ultimate authority. What do you think? Should AI wield this much influence over your healthcare? Are the proposed safeguards enough to protect patients, or is a dangerous precedent being set? Share your thoughts and join the conversation below.